Good evening, folks. Now, this evening's topic C, we're talking about rising elder care costs and caregiver strain. Okay? Reflecting three solvable system failures: an unpaid shrinking direct care workforce. Okay? So that is discussion C for tonight. Here we go. Rising elder care costs and caregiver strain reflect three solvable system failures: an unpaid shrinking direct care workforce, a financing model that pushes families to spend down into Medicaid, and an over reliance on unpaid family caregivers. Policy action that stabilizes the workforce, expands affordable home and community-based supports, and protects working caregivers will reduce cost and improve outcomes. This brief summarizes the problem, its roots, its root drivers, and a prioritized set of policy options. To close systematic gaps in long-term care, or LTC, it is aimed at state and federal policymakers, budget offices, and advocacy coalitions seeking actionable reforms that reduce family financial risk and preserve access to quality care. Key considerations to guide policy design: who pays, federal state split for Medicaid options include federal incentives, targeted grants, or benefit redesign. Where care is delivered, expand home and community-based services, or HCBS, to reflect preferences and lower per person costs. Workforce pipeline, wages, training, and imaginative or immigration visa policy affect supply and turnover. Clarifying questions, target populations, budget horizon, political feasibility, and matrix for access, quality, and caregiver well-being. Problem and evidence concise. Workforce shortages are acute. Nearly all nursing homes report open positions, and many have reduced admissions because they cannot staff beds. Demand will grow rapidly. TLSS substantially over the next 15 years, driven by population aging. Family caregiving is an economic backbone and a hidden subsidy. Unpaid family care was valued at roughly 600 billion in the recent estimates and imposes large lifetime earning losses on caregivers. Priority policy options: short, medium, and long term. Long term, 1 to 3 years. Targeted wage supplements and recruitment grants. For direct care workers, tied to retention matrix. State expansions for paid family and medical leave. An employer tax credit to reduce caregiver job loss. Medium term, 3 to 7 years. Medicaid HCBS rebalancing with federal matching incentives to shift capacity from institutions to home-based care. Subsidize respite and caregiver support programs to reduce burnout and delay institutionalization. Long term, 7 years plus. Sustainable financing reform. Options include public LTC insurance, targeted savings incentives, or a federal state benefit floor to reduce spend down pathways into Medicaid. Implementation risk and mitigation. Budget shock to shares or to states. If federal matching changes, mitigate with phased funding and targeted waivers. Provider consolidation or closures. If wage mandates are unfunded, pair staffing standards with direct subsidies. Unequal access across states. Include equity matrix and federal minimums to reduce geographic disparities. Nursing home closures have materially reduced local access to long-term skilled care, especially in rural counties, and are driven by chronic Medicaid underpayment, post-pandemic cost pressures, and persistent workforce shortages. Policymakers must act on staffing, financing, and targeted rural supports to prevent further displacement. Key considerations, clarifying questions, decision points. Key considerations: budget, explore workforce capacity, geographic equity, payer mix, Medicaid dependence. Clarifying questions: which uh, jurisdictions to prioritize, statewide versus rural counties? Is one-time stabilization funding politically feasible, or only recruiting rate changes? What timeline and matrix access, quality, caregiver retention will be used? Decision points: targeted rate increases versus grants, HCBS expansion versus facility preservation, short-term stabilization versus long-term financing reform. Analysis and evidence, scale to closures and capacity loss. Industry reporting documents at least 774 facility closures and 62,576 fewer nursing home beds since 2020, displacing tens of thousands of residents. Effects concentrated in rural areas. Operating capacity decline beyond bed counts. A recent analysis found operating capacity fell roughly 5% below in 2019 levels nationally. With much larger declines in many rural counties. Small percentage drops can meaningfully disrupt hospital discharges and patient flows. Medicaid underpayment as a structural driver. Multiple analyses show Medicaid often reimburses below the cost of care, leaving facilities financially fragile and vulnerable to proposed federal and state Medicaid reductions. Workforce dynamics. The sector faces persistent recruitment and retention challenges even as jobs recover. Workforce projections and federal briefs. Highlight ongoing shortages and the need for pipeline investments. Risks, trade-offs, and mitigation. Underfunded staffing mandates. Risk accelerating closures. Mitigate by pairing mandates with phased rate increases or transitional grants. State budget constraints can produce uneven access. Mitigate with federal minimums or matching incentives targeted to high need rural counties. Short-term fixes without structural reform may only delay closures. Combine stabiliz- combine stabilization with medium term Medicaid and workforce reforms. Recommended next steps: practical, immediate, deploy targeted stabilization grants tied to retention matrix in counties with recent closures. To near term, model Medicaid rate increases and HCBS expansion scenarios, fiscal and access impacts. Pilot launch wage plus training pilots in high shortage counties and elevate retention equity. Map and prioritize. Produce county level access risk maps to target rural support and mobile services. Long term, convene federal and state working groups to design durable LTC financing options. Confirm these steps against your state budget and stockhold priorities. All right, guys, I will see everybody later. For now, Gator Wellness, take care, folks.